Welcome back to Jersey Matters. We continue our conversation now with New Jersey Health Commissioner Sharif El-Nahal. The last time I spoke with you, we talked about the tragedy at Wanaque Nursing and Rehabilitation Center in North Jersey. At that time, 11 children died, children that are severely and long-term disabled, getting treatment there. Last time we talked, I had mentioned to you, and this is when the crisis was happening, I asked about a possible criminal investigation. And you said at the time, I don't want to talk about that right now because we're in the process of investigating. Can you talk about it now?
Well, I just want to first continue to express my condolences to the families, especially for the children who passed away. 11 children, in addition to dozens of cases. It was one of the most devastating outbreaks, certainly that I've seen in my tenure here. And so my task as the top public health official in New Jersey is to learn from this from a system standpoint and figure out what we can do to better support facilities, local health departments, and what we can do better as a state to respond to these outbreaks. So that's been our focus. Matters of a possible criminal investigation should be addressed to the Attorney General's office. That's their purview, in addition to local law enforcement. We're focused on what we can do to make the system better and responsive to be able to, it's hard to prevent these outbreaks from happening because it's just a matter of a family member or staff member unconsciously bringing in an illness, but how to respond to them and to limit their impact.
I want to talk about medical marijuana and legalized marijuana. Medical marijuana, there is a bill that was pushed by Senator Joe Vitale that is now it passed easily through the Assembly. It came out of committee. Now they seem to be tying, and it would expand access to medical marijuana. I'm sure you're in support of this. Now it's been tied to recreational marijuana. It won't go up for a final vote. It's almost like it's being used politically to get people to vote for legalized marijuana. If that's true, that has to be frustrating for you.
Well, I will say that our priority is really to expand the program, as you mentioned. We want to see that bill passed, and the way that it's passed is up to the folks in the legislature and in terms of getting it done. But the bill does several things that are absolutely needed. The first is that it increases the limit over time for all folks who get the therapy, and it removes the limit entirely, the monthly limit, for terminal patients. Right now, I can prescribe as much opioids as a patient needs if they're getting palliative care or an end-of-life care, but I can't for medical marijuana. And we've heard so many stories of people who, towards the end of life, it's the only drug that allowed them to share meaningful time with their loved ones, most notably Jake Honig, a child who had metastatic Ewing sarcoma, severe case of end-stage cancer. Medical marijuana allowed him to spend his last moments with his family as a child again.
How do you feel about recreational marijuana?
I think we would have an important public health role to make sure that, for example, there's responsible, moderate use. Do not use before driving would be an important public health message we'd put out. The safety of edibles. Edibles are, if you don't use them responsibly, can be dangerous because the effect is not immediate. It takes at least an hour, even longer, to take effect. And so people can overconsume. If they overconsume and drive, that can be a problem. So we would have a public health role there. I support the social justice means to do this, the social justice justification. The fact that black individuals in this state are incarcerated at 3 times the rate as the general population, including for low-level drug offenses, is inexcusable. And I think that's the motivation the governor has, and I share that with him.
You don't have to legalize it for that, right, though? You could decriminalize it.
I think the issue is if you only decriminalize it, it still leaves the black market as the main mechanism, and we know that marijuana already exists in our communities. And so the concern is that where a legitimate regulated market could come in, you would have still that black market that dominates and causes problems. The other thing is a legal regulated market allows for safer products. So for example, the Attorney General has told me that there are medical marijuana black market strains that are now laced with fentanyl. Fentanyl is the main reason, because it's being put together with traditional heroin, that we're seeing a dramatic rise in opioid overdose deaths while we're seeing prescriptions go down. So, you don't know what you're getting on the black market with any drug. And because use is quite common, unfortunately, a legal regulated market could be safer for the population.
Wonderful, thank you.
Thank you.
New Jersey Health Commissioner Sharif El-Nahal. Jersey Matters continues right after this. Still to come on Jersey Matters, we're going to talk more about measles after another outbreak, a new push to get more children vaccinated. That's when we come right back.